Welcome everybody to this Life After Lockdown presentation by the University of Technology, Sydney. Today's topic, caring through a crisis, is going to, given I think the fact that the crisis is moving so quickly and the features of the crisis are changing so quickly, we're both going to talk about what it's been like in lockdown, the lessons that we've learned, but also the things moving ahead that can be useful for us in the future, as well as the things that perhaps didn't work so well during lockdown that we need to take into account as we think about future policy and services for carers. My name is Carol Mills. I'm the Director of the Institute of Public Policy and Governance here at the University, and I'm joined today, as you can see, by three panellists. Elena Katrakis, who is the Chief Executive Officer of Carers in New South Wales and also an industry fellow with my institute. Tanya Teague, who is the carer in residence at the Institute and who has a very special role in our program as being someone who is an active carer and keeping us honest and making sure that our research is targeted to things that really make a difference on the ground for people such as Tanya. And Simon Darcy, who's a professor in our business school, who is an expert in disability and has a great depth of knowledge around caring related issues. And again, our focus today is going to be on moving forward as well as what did we learn from the crisis. Before I begin, I'd like to acknowledge I personally am on Gadigal land today, the traditional owners part of the Eora Nation. Many of us are scattered around places, but I therefore pay my respects to elders past, present and emerging in all of the countries upon which we're meeting today. If you have any difficulties with the panel seeing us or any other technical difficulties, please put something into the chat so we can try and manage that, but hopefully it will be smooth technological sailing today. One can never be entirely sure, but hopefully the UTS systems will keep us in good stead. So let's begin. The things we want to talk about today, as I said, are in a series about life through the crisis. There are many lessons to be learned. Issues of caring are quite complicated because they intersect with disability, they intersect with health and well-being, they intersect with mental health, physical well-being, and some special issues have arisen right at the time of the COVID, I suppose, interventions commencing. One was that we've introduced through the government a whole new system of dealing with carer services, and it happened to commence right about the same time as the lockdowns began. So a very particular challenge of rolling out an entirely new program in an entirely unpredictable and unique way. So lessons learned from that is going to be very interesting. And Elena is one of the service providers across Australia who is struggling to make sure that that service runs as well as it can in quite challenging environments. The other thing that we've found, of course, is that the isolation that people are suffering from or have suffered from, particularly people who were already in receipt of care and assistance in a more formal way who weren't able to receive that, has been an interesting emerging issue, as well as, I guess, the demands of informal carers, being at home, not working from home, changing routines, having children at home, a whole lot of things that have happened to our lives, needing to visit elderly friends and relatives who might normally be more self-able to take care of themselves, but during the COVID crisis rely a lot on informal support. So a lot of different lessons have come out of, I guess, not just thinking about the conventional caring model, but how quickly we can change and all ourselves become carers in some way, shape or form when something quite small happens in our lives and changes expectations on what our roles and responsibilities are. So, we have nearly 1 million, or certainly over 850,000 formal caregivers in Australia. It's not an insignificant number. We often think about them, particularly about caring for older people, but they are. We have many younger carers. We have people caring for people with chronic illness or life-changing circumstances that could be short or long term. And it's a very, very diverse group. And so, one of the things, again, for us to think about is that carers are different people, they're in different situations and they have different needs. So how can we in our programs and our government supported programs and our research really learn how to make sure that things are tailored well, work well for carers in a range of different environments? So we're going to have a little bit of a beginning of just really being clear that, we know what carers are and that we're talking, the sort of group that we're talking about. And then, as I said, we want to really talk about some of the practical issues that have arisen and some of the policy ideas that might come out of the lessons learned. So can I begin by turning to you, Elena, and just ask you a little bit of definitional work for a moment about who we think we're talking about in this discussion today, and also just some of I guess, the major things that you've seen starting to emerge with the dual role you have of being an advocate for carers, but also a service provider, and how the current climate has really affected your role.
Yeah, thanks, Carol, and thanks, everybody. When we're talking about carers, we're talking about informal family members, friends that might be caring for a loved one, friend, family member that might have a disability, might be living with a mental illness, might have a chronic condition, a terminal illness, might be ageing or frail, might have a drug and alcohol dependency. Oftentimes there is a lot of debate and misuse of the term carer, because often, you know, they're talking about paid care workers. You know, and I think where we've had the clap for carers in the UK, which people might have seen, that's referring to paid, you know, they're clapping for the paid care workers that are supporting the health system. But in our space, in our world, when we're talking about carers, we're talking about those informal family members and friends caring for somebody else. In terms of the, I suppose what carers do, they can do anything from, you know, assistance with day-to-day living, you know, feeding, bathing, dressing, toileting, all of those sort of things, depending on the needs and the supports of the person that they're caring for. Some carers care a few hours a week, you know, up to, you know, caring responsibilities that can be 24/7. You know, so they can do a whole range of different things. And as Carol said, carers come, you know, from all different cultural backgrounds. There are 2.6 million carers across Australia, the over 850,000 of those carers in New South Wales, and around, I suppose, just under 100,000 of those carers in New South Wales are under the age of 25. So young people in caring responsibilities, often caring for a parent in a single parent household, but also often sibling carers, and that sort of thing. So it's important to think about, you know, young carers in this context as well. So some of the challenges I think we've seen for carers, we've done a number of consultations with carers, I suppose other NGOs and stakeholders in touch with carers, and also through some of the researchers that we work with in the carer space, just to get their view about what they're seeing as the impacts on carers over this time. And we know that caring's an isolating experience generally, but we've certainly seen that isolation increase as a result of the impacts of COVID-19 and caring within the context of COVID-19. So often where, I suppose, families would have additional assistance or that informal and accidental respite, if you like, when other family members might come over and do those sort of things and engage, or, you know, come over while the main carer might go shopping or do something like that. That hasn't happened. So there's informal additional supports that have been supporting families have not been able to take place because of social distancing. Often when you're caring for somebody, they are, you know, very vulnerable because of their health conditions and other illnesses and things like that. So the impact, you know, on that person and that caring unit within that family home means that they've also then not allowed other people in. So even where there's been a network of formal care services coming in, those care services often haven't come in or continued to come in during this time. So I think there's a whole range of those sort of personal and isolation impacts that also impacts on the family carers' health and well-being, on their mental health due to that sort of isolation. So there, I suppose, some of the initial things that we've seen. Then we've seen some of the things around the financial impacts, you know, increased costs, difficulty, you know, obviously in the early days, not so much now, but that difficulty getting, you know, groceries and equipment, the personal protective equipment has been non-existent, and carers haven't come into any of the messaging around, you know, access to some of those things as well. So they've needed that if they're in isolation, caring for someone by themselves within their home. If they're caring for someone one-on-one, they also might have health issues themselves. So, you know, being able to go out and shop and do all those things has also been difficult. You overlay that with living in a rural or a regional area as an informal family carer, groceries are not delivered. You know, there's less informal supports available within rural and regional New South Wales. So there's a whole range of, I suppose, different and additional impacts that we've seen there as well. The other thing for family carers, for those that are in paid employment, so those working from home, balancing care with work, some of that will have been quite positive, and that flexibility will have been really positive for a number of carers. And for those employers to see that some of that flexibility can work. But on the flip side of that, if you've got carers, and often called, you know, sandwich carers, where you've got people in their sort of 50s, 60s caring for ageing parents, but also then maybe having younger children within the family home as well. So doing that sort of balancing act between that homeschooling that was happening for quite some time, as well as then the additional caring responsibilities without the additional support of formal paid supports coming in, has had that sort of, I suppose, multi-layered impact on that family.
I mean, there's so many issues to unpack in that, but I think two or three in particular, the role that a carer the supports that a carer themselves might normally have, both informal and formal, are not present. Yep. In addition, they are taking on additional duties because the support needs of the person for whom they're caring may in fact have increased over this time, because we're very conscious about vulnerability and health concerns, and as you said, the lack of protective wear, etc., being an issue. The entire household being more isolated than would normally be the case, and so as a group not having exposure and breakup of time with others, and then of course the ability to actually connect up to services relies on having the time to do it. And if you've also got children at home or other things that are happening in your life that aren't part of your regular routine, that break for routine is often one of the hardest things for families to cope with.
That's right.
And certainly, when I worked in disability, it was always one of the most significant things, that families built their systems around the routine of schooling, the routine of service provision being provided, the routine of knowing who would be home and when.
Yeah.
And when that's shut off really quickly, it's very challenging.
Yeah, I think you also overlay that with, particular caring situations where you have, someone caring for a partner with dementia who has really no concept of these changes, the concept of the having to wash your hands, using hand sanitizer, social distancing, not really, understanding any of that.
Yes.
It's the same when you're, a parent caring for a child that may be on the autism spectrum. And obviously, again, individuals experience autism in many different ways, but often young people with autism, living with autism, are, like routine, like all of those things. So again, it disrupts all of that. And it's very difficult to manage and do with that. The other thing that I would add, I suppose, to the particular challenges is that in terms of us rolling out the gateway services, which we're doing in one of the regions of New South Wales on the Central Coast, Hunter, New England, North Coast, has been that we've moved a number of services to online and digital, and doing online, counselling, trying to do some online peer support, and a lot of services across the not-for-profit sector and everywhere obviously have moved to online. Now that's okay, and that's met a need in this gap and in this time. But there is, I suppose, some issues around digital access for carers, not only just, I suppose, accessibility, but the cost of that access, accessibility through NBN and other, avenues not necessarily being great everywhere, the cost of that for families, availability of having enough devices within a family, but also then digital literacy for some carers in some population groups as well. So access to all of those things, it's great that things have moved online, and I suppose it's opened up a whole other world of change in terms of how services are delivered and how services can be delivered, but there is still some limitations for that.
Thanks. Tanya, you're a carer, as I said at the introduction. How much does this resonate with you as your experience over the last few months?
Very much, very much so. Particularly the digital literacy aspect, I think that's been one of the challenges, because I'm a carer for my mother, so she's in that older generation as well, where yes, they know how to make a Skype call, but there are so many different technical options came available to communicate with, and Zoom and House Party and these kinds of things, ordering groceries online. So I found myself having to reframe how I provided care, being able to teach my mum, increase her digital literacy with these facilities and services, but also physical, maintain my physical distance. And so that was certainly a challenge. And yeah, it's really one of the big challenges was really reframing how I could provide care. Again, so my dad also provides care for my mother. So it was with two vulnerable people in the household, it was very much how I protect them and myself, thinking about the different contacts that I might have had, and how I can just mitigate any risks. And also about describing to them and helping them to understand what these risks are as well, and enabling them to speak up for themselves, to maybe challenge or just question some of the paid carers that were coming in. So one of the issues I had was that the personal protective equipment that was provided or not provided to one of mum's service providers, it was non-existent at one point, so I had to request that masks were worn every time paid carers came into the house. And again, that was challenged, which I found a little bit surprising, but I pushed, and I knew I was right in doing so. And again, it's that challenge of knowing your information and being sure about yourself and what you need and what those people you care for need. And that's certainly been a challenge, especially when information was changing so frequently. It's hard to keep up, but make sure that it's not just hearsay and the headless chicken kind of mentality of just going, oh, well, I think I need a mask and I need gloves and I need sanitizer. It's what do we really need and what's being practical and what is helping, and maintaining that level-headedness through a pandemic like this. So yeah, and also translating the understanding of what my concerns were to those who I had contact with. So during the crisis, I was in a share household, so just communicating to my flatmates as well about what my needs and concerns were, why I really needed them to wash their hands every time they came in and out of the house, just to make sure that they were protecting me, because it means protecting my parents. And just how widespread a small issue could be, such as, okay, the way this disease transmits, we don't know, so we need to do everything we can to protect all of our vulnerable people. So yeah, it's very much a role shift, and I know it gave some of my peers who aren't carers very much an insight into caring responsibilities. A lot of these role shifts and role reversals came about when, particularly at the beginning of the crisis, peers' parents were going out socialising. It's okay to go to the grocery store. It's okay to touch this and that and have these friends over. And the concern was very much there, where it was like adults being teenagers again, getting parents to stay home, limit their contact, not go out with people they didn't know, and just really getting them as well to understand the potential consequences of not adhering and not following some of these government guidelines and recommendations, because in the end it was also not just protecting them but protecting others. So that was certainly very much a challenge. And then healthcare as well, it was quite interesting with my mum. So we never used telehealth, but we had a specialist doctor's appointment at one point where we had to have a phone call, and it was about going through all her needs as well, and ensuring that I was able to translate what mum needed, be able to talk to the doctor about maybe what mum was doing, and to focus on I guess translating what mum sees versus what I could see as well, and getting the specialist doctor to see this. So it was quite a challenge, but then it was also good in some ways where I didn't have to drive mum the hour return trip to the hospital. I didn't have to wait for the service. It was all very much on hand. So again, it was just interesting about reframing, well, how do I provide this care? And again, because I wasn't as hands-on, it was quite interesting that I started to find different ways to help. So I made more pre-prepared meals for my parents. So it was a less of a concern for them to go out to the supermarket to buy fresh produce, to make sure that they were eating healthily as well. Because yes, you could get takeaway, but that's for a sustained period, it's not good and it's not financially viable. And so just being able to communicate in advance what groceries do they need. So I, who was already going out into the community, I could get groceries when I was getting my own, and just doubling up, let's say, and making sure that they were looked after and protected. So it's interesting.
Yeah, and I mean, you're a person who is partly because of your role with us at the university, but more broadly, you're well familiar with the service system and you're well used to navigating it. But you've just expressed a number of the challenges around communication and how to interpret information, and indeed to educate your peers and your friends about the fact that whilst they might not know your parents, their behaviour was in fact going to potentially impact on their parents if you yourself were unable to care, or you took COVID into their household or something like that. So did you find the information improved during the time, or did you find an easy place to navigate? Did it become simpler for you?
I think information did improve, and as media has its part to play, and so that definitely highlighted seeing, as we weren't at the first wave, let's say, so we weren't China, we weren't Italy, we weren't these countries where we could see what was happening. We had a little bit of a forecast, and I think that was also beneficial. And a country like the UK, who Australia looks to so often, we were able to see what was going on in these countries to provide as an example, and then maybe learn a little bit so we didn't quite hit those, the crises, the level of crises that they had. So yeah, it was really interesting. And I think one of the advantages I guess we'd had as well, I felt I had, is as we'd had the bushfires just so recently, small things like having an emergency care plan. It was something that had come up in that time, and just me being aware and having contact phone numbers and knowing who to call and who my parents need to call should something happen. We had some of this in place, and I think that helped us to be a little bit more prepared. And so jumping from one crisis to another, strangely enough, actually had built up that bit of resistance, and so we weren't in that crisis point of planning. We were able to, be like little ducks and be calm on the surface and just have our feet just, ready to roll.
You mentioned that your father is also a co-carer with you, with assisting your mother. How did he cope? Has he articulated any of the challenges, particularly that he faced as someone who was residing with your mother?
So, well, he's an older gentleman and who doesn't express his emotions and feelings super well. I could see that he was certainly getting frustrated. At first, he really did take it in his stride and knew he needed to step up, and really did. So one of the tasks I often would do for my mum is assist her in the bathroom, and I couldn't do that. I was not touching mum. I was actually keeping out 1.5 meters. So he had to step up a lot more, and I could really see it wearing. And I was attending their home only once a week, which I felt wasn't enough. And I made sure that I checked in a lot more, because I understood that if there was any way that my dad, if he was feeling a little bit unsure or uncomfortable or needed the assistance, just by checking in, just by calling, I felt it helped. I don't know if he felt it helped. Maybe I was being the nagging daughter. I don't know. But I had to, again, as I reframe just how I provided care. Dad's 80. So again, there's a certain level of care I need to provide, even though he's able-bodied. There are certain concerns as well where I need to make sure he's still looking after himself, And again, that was me providing food, like cooked meals and things like this, just to provide that extra less thought, let's say. So just make it a little bit more streamlined, make things seamless at that back end, so that when Dad's there providing that first line care, he didn't have to consider some of the other potential issues.
Thanks. Simon, we've heard a lot about some of the unintended consequences or the speed with which we've had to bring in new systems. So there was a desire in the new Carer Gateway, as Elena said at the beginning, that much greater utilisation of the internet and technology to assist carers in their role, counselling, access to services online and so on. But we didn't have any transition arrangements in place to support that in the way that perhaps would have been desirable had we been able to foreshadow the future. Tanya spoke also about having to quite rapidly bring her parents up to speed on things that already existed in our, online shopping and so on, but weren't part of their daily routine. What do you think from a policy point of view, some of the things that we can take forward or that you've seen that have fit that characteristic? Are there new things that we need to make available, things that can be utilised in a different way on government that can actually support how to have caring needs or have people with a disability?
Yeah, thank you. I'll just premise my response to you by saying, yes, I am a professor in a business school, but I'm also somebody that's had a high-level spinal cord injury for 37 years. And I'm been deeply involved in the advocacy community within disability organisations. And I wanted to actually start my response by just mentioning the name of Sumith Premachandra, who was a disability support worker in Victoria that died of COVID at the start of April. And really, to the point of a disability support worker death, there was a terrible silence, omission, and overlooking of disability in the same context as what the aged care sector was included within the broader health environment with COVID coming to Australia. So I can't say enough that the silence of the ministers for disability across the states and in the contributions to the national cabinet up to that point in time really didn't consider disability. So we've already heard of the importance of having access to personal protective equipment, because you can't do care work for certain types of disability at 1.5 metres. I'm one of those people. I can't get in and out of bed. I can't get into the bathroom. I can't do what I need to do to be in the chair as a professional without care workers coming into the house. Now, in the same way that Tanya said, she had to reframe what the expectation of whether it was agencies or individual workers coming into the house. I had to do the same thing. And of course, while we all looked on with shock over people fighting over toilet rolls, there was a similar struggle to find enough hand sanitizer once we got into March, and that's where it all started. So most people with disability on the NDIS, and I'll premise again by saying there are 4 million people roughly who identify as having a disability in Australia. When the NDIS is fully rolled out, that will take care of, let's say, 500,000. Plus or minus, a few tens of thousands. And they're people that have got what's regarded as a severe or a profound level of disability. And those people generally are people that will have care workers, formal and informal, in their houses. So this was very foreseeable, yet very forgotten early on. So, prioritising forms of protective equipment. Also having workforce planning, so that there is a collaborative, cooperative effort between organisations. Now we've just gone through, I don't like using the words myself, but we've gone through a marketisation of disability as a commodity with the NDIS. Now the NDIS has brought a lot of increased resources to the whole area of disability, but it's had a system that has been not easy to navigate, would be a true understatement. It's got a portal system that 5 years before the NDIS came in, we knew wasn't up to scratch for Centrelink, but we use that same architecture. It doesn't respond quickly to change. Now, I will premise that there's been a change in CEO, and that CEO has maybe started to assist in bringing about some swifter movements. So we have seen some changes that came about quickly after Paul Smith's death within the disability area. A recognition that there would need to be a series of further real supply chain changes. So whether it was supermarkets and being able to purchase online, so there was both the Woolworths and Coles came out pretty quickly with their approaches. Then the NDIS provided numbers for expedited arrangement around purchasing. But as Alina said earlier on, that wasn't the same in rural and remote areas where you didn't have those same opportunities. Now, people think about disability in a rather homogenous way. Now, whether it's the person they know who has a disability or whether it's, somebody in a wheelchair, but disability is a really complex area. So it's mobility, but is it a, manual wheelchair using person, somebody in a power chair, older people using scooters, other people with ambulatory care, or is it hearing, vision, cognitive, mental health? We all had that really uplifting story of the young lad with autism who was rescued from the bush. Now, this shows what the spectrum of disability is and the different styles of support that are required. So when we saw some collaborative effort between disability organisations with AFDO and also a collaborative of universities that came together to force these issues at a policy level, we started to see some movement. But we shouldn't have got to that point in time. These were foreseeable. We saw some horrific things occur in Italy where a younger person with a disability starved to death within their home because their informal carer was deeply in trouble with COVID in the hospital system. Now, thankfully, we mightn't have seen anything like that happen, but we did see a whole series of ongoing issues with abuse while the Royal Commission is still occurring at the moment. So what are the things I'd like to see? I'd love to see a much better strategic planning framework come out of COVID for future. I agree with what was said by Tanya and Elena previously around bushfires had already brought this to the fore, so emergency planning, and there were a series of issues. I couldn't believe that a person that was able-bodied but blind was refused entry onto a Navy boat for evacuation from one of these areas. I mean, where did that come from? They're evacuating people with all sorts of terrible military injuries, but they couldn't take one blind person away from the South Coast. So these issues need to also be normalised within organisations who don't ordinarily deal with disability. So disability is seen as part of human diversity, not as some form of other consideration to be added on at the end. So I think I'll stop my answer there at the moment. And
well, I'll take that forward if I might, because it's a really important issue. As I said, we wanted to talk about both the experience that occurred during COVID and how we actually learn from that, but either by taking good things forward or by preventing the things that weren't so effective from recurring if we have another incident. You spoke just then a lot about cooperation and the need for people to work collegiately, whether that be organisations or individuals. I'd like to pick that up. You also spoke about, the lessons learned. We've had the bushfire crisis. Tanya gave a very practical example in her own individual household of having used that as a way of thinking a bit more forward thinking about emergency planning. But, we do remain often very reactive in our policies.
Yeah, and I'd pick up on the point I was making about marketisation and disability. We used to have a sector that was predominantly non-for-profit with some for-profit, and whether and there was a certain degree of cooperation. Now, I would hope that the for-profits that are now much bigger, and there's been a real folding of older style organisations, particularly smaller organisations within the system. I would hope there would be a cooperation between having some sort of shared workforce contingency when these issues hit. Because as we saw with the aged care system, it only takes one worker to end up with 25 deaths, 70 care workers taken out of place in one area. And while we saw the Commonwealth Government put in teams, and I think many times they took them too long to get those teams in, what happens in the disability sector if one geographic region does have an infection? Do we just leave those people with disability to die in their homes? What is that strategy that can bring a competitive cooperation together? So I think there's a whole series of issues around workforce innovation that we need leadership on, and we need to be thinking of those. And I know we've got a whole new generation of CEOs in some of these organisations that do want to be innovative, and they do recognise that as an area there are some significant workforce issues that we need to work through, and that we look forward to getting some transformative solutions coming out of that.
Thanks. Elena, you've just been charged as a service provider of establishing a new service system, as I said, rather challenging in the sense of coinciding with COVID. But picking up on some of the things that Simon's just spoken about, have you witnessed those? Have you tried to overcome those? Are they affecting how you can deliver services right now?
Yeah, look, I think all of the service, I suppose, delivery has been affected, and I agree with a lot of the things that Simon has said there. I mean, there is a particular need for that strategic planning that is across all aspects of the sector and community and mainstream, because I think it is about bringing disability carers, all of these players together to have some of that planning, so that it is it is seen, it's not seen as separate systems. The interrelationship between how all of these things play out in the community, whether it's as a result of COVID-19 or bushfires or other natural disasters or other things that affect the community broadly, you have to bring all of those kind of players together to have that strategic planning framework, so that all of those areas are covered off. In terms of the specific challenges of delivering new services in this context, I mean, there has been huge limitations on things like the provision of respite, the availability of respite, in terms of workers not being available, not wanting to put themselves at risk to come into homes, aged care facilities having a very, and look, understandably, but a very high degree of scrutiny and testing before people can go into a respite bed. The limitations that we've seen on family members attending residential aged care facilities in that broader context has had a really you know, profound impact on families, not being able to see their loved one in those circumstances, not having enough workers within those facilities because of this impact. So I think there's a whole, you know, range of things that are happening across those community structures as a result of this.
We've got a question from the audience, which I think directly links to what we've just been talking about, and that is looking globally. What nation is leading the way in supporting carers and people with a disability? Where, you know, are we best? We may not be best practice, but are we leading practice? Are there models that we should be looking at elsewhere? Simon.
In the more in the informal caring space, I certainly that's not my area, so I'll leave others to comment on that. There's been challenges in you know, across the globe with these issues. Historically, we've looked at areas in Northern Europe. Some of the Scandinavian countries have really led the way with independent living. The west coast of the US certainly was at the forefront of independent living movements. We know that individualized packages, we were probably 10 years behind, and that we really have been doing catch up around that space. When it comes to COVID, there's just so much information overload at the moment. We're all trying to make sense of it. So at this stage, I can't really make a definite response to if anyone's done it better. I'll certainly be interested to have a look at Sweden and disability, given that they just decided not to lock down. And I'll leave you just with a final comment on this. I've been talking to a lot of people with disability, a lot of disability organisations, and none of us are running to go back to our, pre-COVID lives at the moment. There's not an antiviral concoction that suppresses the effects of COVID. We haven't really got anything that looks like a vaccination in the short or medium term at the moment. So I think a lot of us are going to be living a more restricted, isolated life because of those issues, particularly around the respiratory function and not wanting to take risk in this space. But one thing I didn't get back to previously that links to this as well is the importance of advocacy organisations in bringing, rather than having to deal with a whole lot of individuals in the system, we still need advocacy to put the position of our collective issues to government. And we know with NDIS, and I'll leave the carers organisations to talk for themselves, but we know under NDIS, many state governments have run away from funding disability advocacy orgs that do really good work in this space, and similarly at the NDIS. So this crisis has shown that there's a need for advocacy to place these issues in a policy context, rather than react to the noisy, squeaky wheel that individuals that might get a response, but that's not built into a systemic response. So the overseas lessons, I think we're just too early to know who's done well and who hasn't.
Thanks. I'm going to ask Elena too about good models, but I would like to come back to the first May marketisation and the support program, which is positive about being for individuals, but how we don't lose that collective gain and do we require advocacy to do it? And you're quite right, there will be significant portions of our population who will remain in areas of vulnerability for some time yet, whilst the majority of us go back to life as normal. And I think one of the things we also wanted to talk about in this is what are the lessons learned? How do we not lose some of the gains that we've had in terms of awareness, understanding of the situation and circumstances of people, how we don't lose that in the morasses of all us rushing back to the pub and rushing back, as I read today, to the poker machines. So, Elena, can I ask you those two things? And then I have a couple more questions coming up online. But is there a good practice model that you look to for carers, and how do you think we can retain some of this either through advocacy or some other means in terms of keeping the profile of these issues on the agenda?
Yeah, look, I think it is about making sure that carers are included in any of the dialogue about what is happening broadly in the community and seen as a group and as a valid group within that. I think some of the, the moving of the work to digital has been a good thing, because I think it is opening up access more broadly on one side to people that haven't accessed services in that way previously, and it is providing them with some different options which they haven't had. But you've got to weigh that up against that sort of digital need and that financial impact of that digital, I suppose, literacy and other things that I mentioned earlier. So I think there are some good things. The other thing is around, with the digitalisation and working from home, is around that flexibility for carers that do balance paid employment with informal caring roles. And I think this is, this is hopefully one of the positive things that has come out of all of this, is that it will show employers that there is that ability and capability for people to work from home, to be still productive, contribute to the workplace, and that will open up different avenues for those informal carers balancing that work and care. So that to me is one of the real positives out of this.
Yeah, thanks. As I said, we've got a couple of other questions that have come in online. I'm just going to ask any of you to respond to this one, because it would affect all of our service models. But in the issue that Simon raised in particular about collaboration across service providers, a specific question about, does local government have a role, particularly in the informal caring, in supporting that in some way?
I'm
Elena,
happy to take that first. Absolutely, local government has a role. In our region, we have partnered with local council in part of the region to deliver carer services. They are a key point for, for access to, other informal supports for carers through libraries and, local community events and services, health and wellbeing, all of those sort of things. So really important to be working with local councils, really important to be working with those localised services on the ground to support carers and people with disabilities at that local level. So absolutely a key player. As part of our model, we're looking at rolling out, when things open up a bit more, rolling out some digital access points for carers within our region, and part of those will be through, not only through the local PCYCs in our region, but also through local council. So they're absolutely a key player.
And that role, I'm sorry, Simon.
No, I was just going to say the other thing around local government that might be interesting, and also around community transport, there's going to be a significant issue with the wheelchair accessible taxis as we move back into a more a more normal work frame, in that many of those taxis have been literally abandoned. So how we get that sector reinvigorated, there may be a increasing role with point-to-point services. The Transport New South Wales had reframed around broadening the sector with community transport options that may be really important until that taxi side of things is able to get itself back up to capacity, because that's critical for standard medical, for people who are blind, those that aren't able to drive, having subsidised transport to get themselves tested for COVID as well. So if those systems aren't there, and particularly in rural remote, but also within the huge metropolis of Sydney, you sometimes got to travel for an hour to get to those places where things are done. So I'd love to see some innovation at the local government level around supporting community transport options as well.
And of course, the introduction of NDIS had some unintended consequences about access to community transport.
Thankfully, New South Wales didn't do what Tasmania, South Australia, Queensland and others threatened to do. I know AFTO have certainly got a very good strategy, and they're reviewing these things. absolute madness to do what they did. It was ridiculous, restrictive. It really made some people's employment unviable.
So again, policy, and I guess this is one of our challenges moving forward, often policy decisions that are made in good sense for a certain population group have unintended consequences on others. And regrettably, the type of people we're speaking about today, people with a disability, their carers, people who are caring for a variety of different reasons, often aren't the first thought about when a policy, either a mainstream policy or even a policy targeting a particular population group are thought about. Tanya, from your experience, what would you take forward as being good for the experience for the person for whom you care, but also for yourself?
Well, as a carer, I'm going to talk about myself because this is the theme today about caring during COVID, during a pandemic. I'm going to echo what Elena said. The flexible work practices has been such a massive win, I think. We can see how quickly organisations can mobilise to put in infrastructure needed to support people working remotely, to work flexibly. And flexibly and remotely doesn't necessarily mean working from home. It can mean coming into the office space if that actually is what suits you best. But it's having that understanding that there are different environments that suit people at certain times, and that might be coming into an office like as I am now at UTS because I don't have internet at home. So this is the best space for me. It's quiet, it's convenient, I have the tech I need, and if I need to work from home, if I have another role, I can do it if I need to. My colleagues can do it. It makes a huge difference because it means it keeps carers in the workforce for longer. I'm not going to say it eliminates it, but carers already face financial precarity, and so by keeping carers in the workforce and in what to them is meaningful employment in areas that they usually work in and have knowledge in, again, you're just promoting that workforce, which we often lose. Carers will so often leave a workplace because they can't work flexibly, and that's a real shame, and we lose so much through that. So I think that's such a massive win, and I hope that it really continues. I don't see a reason why not, but it's you never know at the end of the day. So hopefully that's more legislation and support that can come from federal and local governments to support us, because it's really, you can see how easy it is. So let's keep that ease happening.
Thanks, Tanya. I'm just going to pick up another question because it follows a little bit from some of the discussion around when people were, particularly during the lockdown period, more at home, weren't able to get to the usual support services. But from a carer point of view, mental health issues, the pressure of being suddenly the only carer or not having the formal support that you normally require. How can carers, and are there places that carers could go to for mental health support that you're aware of, or is it part of the system? Is it something that we need to think more strongly about?
I mean, I think there's a broad, obviously, range of mental health issues, but in terms of access and support for the carer themselves, I mean, I think the first point of call would be the Carer Gateway, and carers can contact the Carer Gateway, be assessed, have a package of supports and services, wrapped around them, but also the gateway is also a bit about that pre-planning and early intervention. So if you might not need services now as a carer, if you're talking to someone, one of the intake and assessment officers, having that sort of planning assessment sort of process, developing that, not just an emergency plan, which is really important, but that sort of action plan for the future for different parts of your life. I think then there are specific things that could be put in if people are having an impact on their mental health as a carer. And there is some additional funding from the federal government that is going out to gateway services from July, which is specifically focusing on delivering some services that will be tailored at the local level. What they look like at this point, I'm not sure. But there has been some specific funding for the mental health needs of carers as a result of the impact of COVID-19.
Thanks. A couple of times we've raised issues, and Simon in particular, I'm going to come back to you now just in conclusion. We've spoken about the government may have been slow to respond in some areas that you gave examples for, Simon, but has responded. Sometimes this is a partial, time limited or very targeted, but if we were to take one or two things forward that really could make a difference, some of the lessons learned or specific responses we've seen, what do you think they could be, Simon, from someone in your situation?
Oh, look, I think without a doubt, some of the things that have already been mentioned, there's been a real problem with employers understanding what reasonable adjustment is. Now, within 8 days, they understood it really quickly. So as people, we need to make sure that that's now systematized, that it's also understood for its complexity, in that, you know, what's reasonable for me will be very different for a person who's blind or a person who's deaf. We also need to make sure that all things about information provision and alternative communication strategies are now totally embedded. So that includes things like, you know, captioning and Auslan, and making sure that that's distributed in ways and to areas where carers and people with disability are going to have good, equitable access to that information provision. And that the innovation that has occurred during this time, and there's been some wonderful examples of that around businesses, for example, retooling so that niche manufacturing filled holes, that those innovative lessons around you know, what a lot of us call transformative solutions for both carers and disability are documented, shared, and implemented in new ways. So certainly, you know, UTS as an organisation is definitely setting up structures to make sure that those innovations have been recognised, documented, and also freely circulated beyond the paywalls of the academic journals that don't do that job very well normally.
Thank you. And we've got about 1 minute left, so I'm going to ask you, Elena, one thing that we could take forward that would really help in the longer term.
Look, I mean, I would agree
Could be a
around the
service issue,
employment
could be a-
stuff. Yeah, I really agree around the employment stuff and that flexibility and adaptability. And I suppose just I'll go to, because I'll just go, just including carers within the messaging and as a group. I think there has been more recognition of carers over this time. And I think for that to be included and be embedded in policy and practice and messaging going forward, I think that's a real positive.
Thank you. Well, look, on behalf of UTS and this session, I'd like to thank and give my virtual applause to our participants today, Tanya Teague, Simon Darcy, and Elena Katrakis, and remind people that this is one of a series of Zoom podcasts, webinars that we're running through UTS. Life After Lockdown next week is covering the issue about kindness and the lockdown. There are more details available on the UTS website, and there are also a whole range of courses and information and free sort of access to free courses and things on webinars on our YouTube and on our main international website. Taster courses, all sorts of ways in which you can get involved in this dialogue. So again, thank you very much. My virtual thanks and applause to our panelists. Thank you very much for joining us, and I wish you all the best.